Hi, I'm Alex Kapur. I'm the CEO of Opportunity Space.
And I'm Christina Garmendia. I'm the Chief Customer Officer of Opportunity Space.
The problem we're addressing is how to accelerate reinvestment and redevelopment of our urban areas, rebuilding our cities, and the role that data and technology plays in that process.
One challenge that governments have is that they don't know what they own. So part of what we do at Opportunity Space is we help them inventory and identify their surplus, vacant, and underutilized properties.
Our solution is a market-based solution. We're creating transparency, information access, and using data and technology tools to inform the private and civic sector of development potentials in urban areas. Real estate, we're talking about land, buildings, and the places to allow people to collaborate and make our cities better places to live, work, and play. So the impact that we hope to have is to enable the public sector, city governments, states, federal government, and special districts like schools or transit authorities to be able to leverage their real estate holdings, things that they're not using, the third spaces, the forgotten places, to catalyze development activity. A city like Louisville, Kentucky holds about 8,000 to 9,000 parcels of property across various government entities. That covers about 15% of the land area. Our aim is to help them work with private and civic sector organizations to reposition some of these assets and find productive uses, increasing the tax base, lowering environmental hazards, and enabling communities to come together around new social community amenities.
Hi, I'm Betty Johnson with the Nebraska Department of Motor Vehicles. Our pioneer project was the re-engineering of the handicap parking permit issuance process in the state of Nebraska. Working with several partners, including the Nebraska State Legislature and the Nebraska Department of Health and Human Services, we've taken a process that was previously 9 steps down to 3 steps. Our goal with this project was to ensure that we eliminated the extra work that was being done by those individuals who were in need of a handicap parking permit, and at the same time to streamline the process so that instead of waiting 3 weeks for their permit to arrive in the mail, that they were able to receive it within 2 to 3 days. What this project did is built an online service that allows a patient to contact their doctor, visit with their doctor about their needs for a handicap parking permit, and then their doctor can simply go online and order the permit. We've been able to authenticate the doctors by using a database that Health and Human Services maintains on doctor licensure information, so it does not require the medical professionals to have another user ID and password for another system. The individuals who need the handicap parking permits have really won through this process, but so have our medical professionals, and so has the Department of Motor Vehicles. To date, we have issued approximately 40% of the permits online, which is a total of over 70,000.
Hi, I'm Caitlin Reiche, and I'm Senior Manager of Corporate Strategy at Athena Health.
And my name is Stephanie Zaremba, and I'm Senior Manager of Government Affairs at Athena Health. Our Independent Risk Manager proposal intends to address an issue we're seeing with the implementation of the Affordable Care Act. A major component of that law is to start paying doctors for quality over quantity through organizations called accountable care organizations. Unfortunately, independent providers are largely left out of this shift because the administrative costs of forming and operating an ACO are so high. Largely, it's hospitals and large health systems that are able to participate in these ACOs. We can't afford to leave independent providers out of this shift to ACOs because they're so essential to providing access to care for some of our most underserved and rural populations. But forcing them to become employed with these large health systems to be in an ACO is only going to accelerate the trend of consolidation in healthcare and lead to increased costs over time. So our solution is to leverage technology to help these providers maintain their independence and participate in the shift to ACOs.
We propose the creation of independent risk managers, or IRMs, that would allow physicians to maintain their independence while participating in accountable care organizations by relieving them of the technological and administrative burdens of participation in these value-based models. IRMs would be organizationally independent from payers, health systems, and providers with the IT infrastructure and expertise to provide risk pooling, care coordination, and care management to independent providers to allow them to participate in accountable care organizations.
The only missing ingredient is some legislative and regulatory authority so that entities like Athena Health can form IRMs and provide these services to independent providers across the country.
Hi, I'm Marty Walsh. I'm the mayor of the City of Boston. I've been mayor since January 6, 2014. What City Hall to Go really allows us to take City Hall to the different neighborhoods of the City of Boston. We allow people to be able to buy certificates, pay bills, and do things like that. We'd like to expand the services someday, but it really truly is a way, kind of in what Kevin White's vision was for little city halls in different neighborhoods. It allows us to bring a truck to the neighborhoods to allow people to have access to their city government. This has been a big impact in the City of Boston. People love seeing it coming up, particularly the elderly love to have City Hall to Go in their neighborhood because they can do a lot of their business without having to come in town. The citizens of Boston that are aware of City Hall to Go love it. I think we have to do more work and more outreach into the community to let people know that when it's there. I think not everyone understands the value of this. Not everyone understands what City Hall to Go is all about. But I think over the course of the next year and a half, we'll do more marketing and make sure that we know. Other cities around the country and around the world are recognizing us because they're calling us saying, how can we do what you do? But we need to make sure that we market this truck more to neighborhoods so people understand.